Hello, everybody. Welcome back to Gyandan. Today is the fifth day of 30 days to a more powerful vocabulary. Words about doctors and specialists. Of course, you know that you have two different kinds of vocabulary, and that one is much larger than the other. Your recognition vocabulary is made up of words that you can recognize and understand when you read them or hear them spoken. Your functional vocabulary includes the words that you can recall and use when you yourself speak. Your recognition vocabulary is about 3 times as large as your functional vocabulary. If, as an example, you study French and you learn merrily to read that language, you will find that you will be unable to speak it because you are practiced only in recognizing the words when you see them, but not in recalling them when you do not see them. Or conversely, if you are taught only to speak French, you will fail when it comes to reading the language because you have not had any practice in understanding or recognizing the printed words. In order to develop both types of vocabulary, it is therefore important that you not only read the words that are new to you in this book and write them down, but that you say them out loud. One other thing is, when you talk, the words and their meanings are conveyed to others by the sound of your voice. This process of speaking, by the way, is not so simple as it seems. Every word that you say out uses 72 muscles in your face and throat. Therefore, respect your voice. Be conscious of it. How does it sound to your ear? If you would care to know, try standing in a corner of your room, read or say some words out loud. If you want a little simpler method, just put your hand behind your ear and speak. Is your voice attractive to you? If it isn't, practice a bit. Relax. Use the lower tones. You'll find them more musical. Now we shall turn to a new group of words. In the last chapter, we dealt with such general and abstract concepts as rationalize and modeling. In this present chapter, we will consider more specific items. The field of medicine is close to your life, so we will introduce you to a few of the doctors and specialists you may have to consult at some time. The obstetrician delivers babies. First assistant to the stork. He practices obstetrics. Obstetrician. Obstetrix. The pediatrician takes over when the obstetrician has finished. He specializes in the treatment of infants and very young children, and the profession he practices is called pediatrics. Pediatrician. Pediatrics. The podiatrist treats the minor ailments to your feet. Podiatrist. He is often called a chiropodist. The osteopath works on the theory that diseases arise chiefly from the displacement of bones with resultant pressure on nerve centers and blood vessels. Hence, his treatment is manipulation of the affected parts. He practices osteopathy. Osteopathy. The oculist or ophthalmologist is a medical doctor and often a trained surgeon who treats the troubles and the diseases of the eyes. He is not to be confused with the optometrist, who is not a medical doctor. The optometrist examines the eyes for the sole purpose of prescribing spectacles or eyeglasses. Nor should either one be confused with the optician, who again is not a doctor. This man is a merchant and manufacturer, making and selling eyeglasses, lenses, binoculars, oculist, ophthalmologist, optometrist, optician. The gynecologist specializes in the diseases that are peculiar to women. Gynecologist. The dermatologist is a skin man. When you have to rash, acne, certain allergies, skin lesions, psoriasis, or any skin affection, he is the man to see. Dermatologist. The psychiatrist is a graduate medical doctor who concerns himself with the mental aberrations with the various psychos that afflict the mind. Psychiatrist. The orthodontist neither fills nor extracts teeth. He specializes in straightening crooked teeth and in correcting bad bites, or as they are called in the vocabulary of orthodontia. Malocclusion. Orthodontist. Orthodontia. Which specialist would you call in? Now you had better review of the words you have just had, as we are going to give you a checkup to see if they are fixed in your mind. Pick up your pencil and write down the title of the specialist you would suggest for each of the following ailments. This is a test of your functional vocabulary. You have a painful corn. You need to know what type of eyeglasses are the best suited to you. Your baby has a colic. You need a doctor to deliver your baby. A friend of yours has had a complete mental collapse. A child you know has a badly formed jaw. Woman is suffering from female disorders. You are troubled with a skin rash. You have an eye disease that needs expert attention. You have an illness which you believe can be cured by bone manipulation. You want to buy a new pair of glasses. Let's look at the answers. You have a painful corn. You go to the podiatrist or a chiropodist. You need to know what type of eyeglasses are the best suited for you. Optometrist. Your baby has a colic. Pediatrist. You need a doctor to deliver your baby. You go to an obstetrician. A friend of yours has a complete mental breakdown. You take him to the psychiatrist. A child you know has a badly formed jaw. Orthodontist. A woman suffering from female disorders. Gynecologist. You're troubled with a skin rash? You go to a dermatologist. You have an eye disease that needs expert attention. You go to the oculist or ophthalmologist. You have an illness which you believe can be cured by bone manipulation. The person you see is an osteopath. You want to buy a new pair of glasses. You go to an optician. Test your ingenuity. We have discussed a number of doctors and, in a few instances, we have mentioned the names of their specialities. Below, you will find a list of specialists. Write in the blank space opposite each one the name of his type of work. For example, a doctor practices medicine, a dentist, dentistry. Use your memory where possible, your common sense in other cases. The answers below will tell you how successful you are at seeing logical relationships between parts of a speech. The doctor obstetrician works for obstetrics, pediatrician, pediatrics, podiatrist, podiatry, chiropodist, chiropody, osteopath, osteopathy, oculist or ophthalmologist, ophthalmology, optometrist, optometry, gynecologist, gynecology, dermatologist, dermatology, psychiatrist, psychiatry, orthodontist, orthodontia. Is there a doctor in house? The terms in this chapter and the specialties they involve will be particularly hard for you to remember unless you have been previously familiar with them. It may pay to close these exercises with one more game in order that these words may be photographed on your mind. If you find yourself tired, skip this until tomorrow. And yet, the present topic may be so familiar to you that the test will prove very easy. You're taking a tour of the professional building in some large city. You're going to see a number of medical titles on the doors as you go down the halls. In each case, check that one definition or description that you believe to be correct, either A, B, or C. Before you look at the answers, see if you can identify or name the professions of the 2 out of 3 that are left. This is a combination functional and recognition vocabulary test. Now let's get to the answers. Room 1. The shingle says John Doe, podiatrist. Let's look at the options. He treats diseases of skin. The person who treats diseases of skin is called a dermatologist. Man to see when you are having an aching corn is the right answer. He practices general medicine. This person could be a physician. Room 2. The coffee of Richard Rowe, psychiatrist. He treats diseases of skin. Again, that's a dermatologist. He corrects malocclusions of the teeth. Should be an orthodontist. People having mental aberrations are taken to him. Should be a psychiatrist. Room 3. The office at the eminent George Jones, oculist or ophthalmologist. The correct answer is A. He knows all about diseases of the eye and refractive errors and often resorts to surgery to correct the eye ailments of his patients. Let's look at option B. He'll examine your eyes and write out write write out for you a prescription of glasses. This person should be an optometrist. He'll be happy to sell you any sort of optical instruments, specs, binoculars, telescope or microscopes. This person is an optician. Room 4. Office of James Brown, Osteopath. If you believe in drugless therapy, you'll be interested in visiting him. His specialty is bunions. This should be a podiatrist or a chiropodist. Holding that disease arises chiefly from displacement of bones with resultant pressure on nerves and blood vessels. He remedies the evil by manipulation of the affected parts. This is the correct answer, osteopath. He fills and extracts teeth. A dentist. Room 5. The name on his door is John Smith, obstetrician. The correct answer is C. He delivers babies. Let's look at option A and B. He treats diseases peculiar to women. That's a gynecologist. And the person who specializes in the ills of infancy and childhood, that is a pediatrician. You have finished what is, perhaps, a somewhat difficult chapter. Medical terms on the whole are artificial words that have not come into being in a natural way, but have been invented by man to identify new specialties as they appeared. For this reason, these words may be especially hard to recall. The more familiar you become with them, however, the more easily you will be able to recognize and remember other words in the field of medicine, and so add them to your growing vocabulary. Always bear in mind that each new word you acquire will open up new vistas to your mind and will have a subtle and beneficial influence on your life. Thank you for watching the video. This was the end of chapter 5. To be continued. Like, share, subscribe.